Hello, everyone. Good afternoon. Welcome to our panel for today. Happy Cinco de Mayo. My name is Erick Orellana, and I'm a senior policy advocate at Community Water Center. At Community Water Center, we believe safe and affordable water is a human right and it should never be a privilege. We thank you for joining us today for an important conversation on safe and affordable water in California. And don't forget to tune in this Thursday as we continue the important conversation with the second Spanish panel. This is the first of two panels we're hosting to celebrate National Drinking Water Week. Today's conversation will include State Water Resource Control Board Chairman Joaquin Esquivel and the Honorable State Senator Bill Monning. But first, I'd like to pass it over to California Secretary for Environmental Protection, Secretary Yana Garcia, for a few opening words.
Hello, everyone, and happy Drinking Water Week. Drinking water is an essential need for all of us, and ensuring all Californians have access to clean drinking water is the vital task we have in front of us. That is why in 2012, California adopted the human right to water, and why in his first week in office, Governor Newsom proposed a permanent funding source for drinking water projects. In 2019, he acted on that commitment by signing SB 200, which created the Safe and Affordable Drinking Water Fund. California continues to remain steadfast and driven to secure this fundamental right. But today, while 98% of Californians have access to safe and reliable drinking water, 2% still do not, and that remains unacceptable. Since 2019, over 250 drinking water systems have come back into compliance, reducing the net number of Californians without safe drinking water by nearly half. That's been a direct result of the State Water Board's Safer Drinking Water program. Since its inception, SAFER has delivered $1 billion in investments. That's over 2.5 times more grant funding to disadvantaged communities than was provided during the 5 years prior to its creation. And through this program, we know that creative and collaborative partnerships at the regional and local levels are critical to achieving our environmental and water supply goals statewide. That is why SAFER is designed to not only fund local and regional projects, but to also partner with communities to deliver sustainable infrastructure solutions that ensure safe access to drinking water for decades to come. Part of this work includes combining smaller water systems that are struggling with stronger, sustainable water systems so that they are more resilient to the impacts of extreme weather and other climate threats. And because of the historical foundation of our water systems, specifically how they have caused or exacerbated inequities, it is essential that we advance fair policies and practices as we build solutions. Of course, none of this work can be done without strong partnerships with water systems, local leaders, and communities most impacted by poor water quality for years, and why it is so important that this discussion is happening today, to come together to uplift conversations across the state on drinking water so that this work continues, and so that together we can realize the vision of clean drinking water for all.
Thank you, Secretary Garcia. In 2019, Governor Gavin Newsom signed SB 200 by Senator Bill Monning into law, establishing the Safe and Affordable Drinking Water Fund. This historic effort was led by community advocacy, and it included environmental justice, labor, public health organizations, environmental organizations, business voices, and more. And SAFER is the first program to provide funding for technical assistance, construction, emergency relief, ongoing operations and maintenance of water systems, and so much more, things that are critical to safe and clean drinking water in California. The SAFER program is also informed by the input of SAFER advisory group members representing small communities, community-based organizations, and other interests across the state to prioritize funding to communities that need it the most. Another important part of SAFER is the annual needs assessment, providing data to help us better understand who lacks safe and affordable water, where they are, and what solutions will cost. We're working at Community Water Center to help ensure that the human right to water for all Californians is a right and not a privilege, but this data shows that nearly 800,000 Californians lack safe water and over 135,000 domestic well households are at risk. Since 2020, the SAFER program has given $1 billion in funding to small disadvantaged communities, serving some of the communities that have the biggest and most pressing needs, and has helped return more than 350 water systems serving 3 million Californians back to compliance. In fact, our organization, Community Water Center, is currently working in 8 communities across the state of California on SAFER projects that will bring safe and affordable water to over 8,500 Californians. To make water safe and affordable for all in California, we must renew the funding for SAFER past 2030. The following discussion that we're about to have will highlight the progress made under SAFER and the importance of continuing this work. And so first, I'd like to introduce Senator Bill Monning. Senator Bill Monning is an attorney who served in the California State Legislature for 12 years, 4 of those years in the State Assembly, and 8 of those in the State Senate, where he served as Majority Leader from 2015 until 2019. He was also designated as the California State Senate Majority Leader Emeritus in 2020. In 2019, his SB 200, the Clean, Safe, and Affordable Water Act, was signed into law by Governor Newsom. SB 200 resulted in a budget allocation of $1.3 billion, $130 million over 10 years. And in Monning's advocacy, he worked with grassroots organizations and referred often to the human right to safe, clean, and affordable drinking water. Thank you for joining us, Senator Monning. And so the question we have for you, Senator Monning, is can you share why you decided to author Senate Bill 200 and what you hope this program would do?
Great. Well, thank you, Eric, and for all of those at Community Water Center for helping organize this. It's always an honor to join Chairman Esquivel in talking about the work in California to bring safe, clean drinking water to all Californians. And your question about what motivated me to carry Senate Bill 200, some of my work background, I was an attorney with the United Farm Workers Union, and then with California Rural Legal Assistance, representing disadvantaged community members, immigrant workers, and people by definition living under the poverty line. And I've also been a public health advocate. My wife is a public health physician. We've done a lot of work in other areas of public health advocacy. I did a lot of work on worker health and safety in the fields related to pesticide exposure. So when I was presented the opportunity of carrying this bill, it didn't require much hesitation on my part. I was honored to be approached with the opportunity to bring the legislation. The power behind our success getting the bill passed and signed into law by Governor Newsom was the power of the grassroots community that had been bringing busloads of community advocates and community members from all over the state to Sacramento for years, trying to get hearings, trying to be heard, and trying to educate members of the legislature to the really public health crisis of communities, over 1 million Californians at the time who did not have access to clean, healthy, safe drinking water, and affordability being a big issue as well. And one of the ironies in this work is that a lot of the contaminated wells, not all of those, but a lot, the source of contamination was agricultural chemicals, fertilizers, pesticides. And so the same communities that were working by day, laboring in the fields to harvest crop to feed America and beyond, were also the victims of the water contamination, the drinking water contamination. So we introduced the bill in 2018 and moved forward with an ever-growing coalition. And I just want to give a shout out and acknowledge some of those coalition leaders who really did the heavy lifting: the Center for Community Water, the Leadership Council for Justice and Accountability, the Center on Race, Poverty, and Environment, Clean Water Now, and some of the heroes of those organizations and founders, Laurel Firestone, Veronica Garibay, Phoebe Seaton, Susana de Anda, and so many more in those busloads that came to Sacramento, from children to grandparents or great-grandparents who would wait patiently to testify at hearings, often waiting all day long to get 2 minutes at a microphone to describe their plight of not having access to clean, safe drinking water. Families having to fill 5-gallon containers with clean, clear water at corner stores, paying for the water they drank, and having to cook and bathe and clean with that same purchased water. So as we moved forward, as the coalition moved forward, we had to go through some different adaptations in the design of our legislative vehicle. And in 2019, we won support. We won some bipartisan support in both the state Senate and the state Assembly, and were able to bring it to Governor Newsom's desk. And to his credit, he joined Chair Esquivel and others from the community organizations in the barrio of Tombstone near Sanger, outside of Fresno, a community that will be a beneficiary of this work of linking a water system of safe water from Sanger to the barrio of Tombstone near Fresno. So little by little, I left the legislature. I was termed out at the end of 2020. I was able to join the signing ceremony that took place in the community of Tombstone with the governor and community advocates. Dolores Huerta joined us as well. She was a strong ally in our advocacy for the passage of Senate Bill 200. So that bill, and just to wrap up on this, the architecture of it was 10 years of funding, $130 million a year, taken from the greenhouse gas fund that's funded by polluters, basically, and seeing that some of the impacts to our water system as caused by the climate crisis was an appropriate remedy to use that funding to remediate systems that have been contaminated, to construct new systems, to link existing systems. And so now, as we are, 5-6 years out from that original funding, we look at what's been achieved. Joaquin will talk more about that, and yet the work that remains to be done. And so as we move forward in this conversation, looking to the ongoing challenges and the ongoing need for state support for funding resources that all Californians should get behind, so that we can once and for all establish and implement the fundamental human right to safe, clean drinking water in the state of California.
Thank you, Senator Monning. Appreciate your inspirational leadership and for you recognizing the efforts that it took to get this monumental piece of legislation passed. Next, I would like to first introduce State Water Board Chairman Joaquin Esquivel. Chairman Esquivel was appointed to the State Water Resources Control Board here in California by Governor Jerry Brown in March 2017. He was designated by Governor Gavin Newsom as the chairman in February 2019 and reappointed to the board by Governor Newsom in 2021. Also in 2021, I appointed him to the Western States Water Council, Colorado River Basin Salinity Control Advisory Council, as well as the Colorado River Basin Salinity Control Forum. Previously, Chairman Esquivel served as Assistant Secretary for Federal Water Policy at the California Natural Resources Agency in the Governor's Washington, D.C. office. Thank you for joining us, Chairman Esquivel. And Chairman Esquivel, the question that I have for you is, what is the state of drinking water crisis in California?
Well, first, thank you, Eric. Really appreciate this opportunity. It's an honor to be on this panel here with Senator Monning. It has been truly a collective effort across the state, beginning at the local level in communities that for decades were suffering under and without access to clean water. And so just really proud of the opportunity to be able to contribute to the work and also speak to it. So in 2019, when the Safe and Affordable Fund was first passed, we still didn't have a full grasp on how many Californians were without access to clean and safe drinking water. Actually, part of our first steps were really developing a drinking water needs assessment that better understood what is the scale and scope of the challenges we're facing, and what are the particular information and situation for so many communities and water systems out there. And what we came to understand was there was about 1.6 million Californians in 2019 without access to clean and safe drinking water. And since then, these last 5 years of the implementation of the program, beginning with that needs assessment, importantly, as the foundation of our decision making, but all then directing that investment to the systems that need it most. We've been able to go from that 1.6 million Californians in 2019 to about 800,000 today. And while there's still a lot more work to do, what we have done is learned a lot. When the human right to water was first passed in 2012 here in the state of California, importantly, this very simple premise that all Californians deserve access to clean, safe, affordable drinking water for drinking and all, importantly for sanitation as well, didn't come automatically with any new authorities or any new funding, and actually explicitly said as much when the human right to water was adopted. And so since then, we've been able to work with the legislature, importantly, work with communities, and develop authorities like mandatory consolidation, and importantly, the Safe and Affordable Fund that was passed in 2019. And so, since that time, being able to reduce the number of Californians here by half, and importantly, bring over 300 water systems back into compliance has been incredible. That has also been accompanied by being able to, here in the last 5 years, 5+ years, be able to accomplish 142 consolidations of drinking water systems. That's one of our important tools, is ensuring to create the sort of regional scale and importantly economies of scale that it takes in order to address access to clean and safe drinking water. We have a number of examples where communities weren't thought of comprehensively, their ability to afford, say, a new drinking water treatment plant, and dollars spent to create infrastructure that ultimately wasn't able to be maintained because we weren't being comprehensive in our approach. We weren't thinking of the long-term resiliency of these systems. And I think that's been an important component of our success in the Safe and Affordable Fund, and the SAFER program has been focusing not just on sort of band-aid solutions, if you will, quickly getting infrastructure projects in place, which is really important, but really thinking about the long-term viability and the ability for a community to afford all the operation and maintenance and costs that we know comes with ensuring access to safe drinking water. In addition, the Safe and Affordable Fund was for a $1.3 billion commitment for our first 10 years. That's $130 million a year. And as you heard from Erick, we've already been able to invest $1 billion of grants into disadvantaged communities and drinking water systems in these last 5 years, which is more, of course, than that initial investment. And that's because between the bipartisan infrastructure law, between the state legislature and the governor prioritizing additional dollars for drinking water, we've been able to leverage that initial $130 million a year to do a lot more. So we continue to learn how best to implement our program here in a way that is moving quickly, but also sustainably when we think about the ongoing challenges that our drinking water systems and communities are going to continue to face. So, as we stand now, 98% of Californians have access to clean and safe drinking water if they're served by a drinking water system. And even on the domestic well side, which, a lot of our work is focused on water systems, those that both, state smalls, they serve 15 or fewer permanent connections, and those that serve 15 or more permanent connections, which are known as community water systems that the state has greater authority and oversees. Both of those have been incredible and important focuses, the drinking water systems themselves, but we have many domestic well communities throughout the state. The community of Tombstone that SB 200 was signed at, that Senator Monning was referring to, is a domestic well community. And those two are part of our work and our program, although oftentimes certainly come at a greater cost and fewer authorities than we have over drinking water systems. But our goal is to be comprehensive in fulfilling the human right to water. And again, really proud of the progress that we've been able to see between the 142 consolidations, the 300 systems brought back into compliance, the halving and cutting in half the number of Californians being served by failing systems. But we still have more to do, for sure. And there are still many communities. And now really what we have in that 800,000 are some of the most troublesome, if you will, and problematic and entrenched challenges that communities and systems have faced, and continue to be just incredibly encouraged and feel very honored to be part of the program and work.
Thank you, Chairman Esquivel, for your leadership on the board and for the board's commitment to making the human right to water a reality for those Californians. And just want to appreciate the hard work that the State Water Board under your leadership has done to really make a dent in the number of Californians living with unsafe drinking water. So thank you for that. For the next question, we'll pass it back to Senator Monning. And so, Senator Monning, can you tell us more about the SAFER program and what success we've seen in the past 6 years?
Yeah, well, thank you once again, Eric. And I just want to thank Chairman Esquivel again. He and his team have done heroic work in maximizing and tapping other resources, as he mentioned, that supplemented the funding available through SB 200. I also want to give a shout out to former State Assembly member Mike Eng, who was the author of legislation that established the human right to water in the state of California. And at the time that bill passed, as Chairman Esquivel mentioned, there was not a funding source to fulfill that confirmation of a commitment of the state of California to establish the human right and to fulfill the human right. And so SB 200 was the first significant funding to try to implement that vision and that dream. But as Chairman Esquivel mentioned, in their survey of assessing water systems, they determined that we're over, what was the number, over 1.6 million Californians who did not have access to safe, clean drinking water. And the fact that that's been reduced by half or over half is really quite amazing. And I would just like to take a moment to remind listeners, viewers, there's so much animus right now in the public commons. There's division in our political systems. There's people who are anti-government, say, government is the problem, government is the enemy. In my view, this legislation and this work in bringing safe, clean drinking water to over 800,000 people is proof positive of the power of what an informed government can do, what a government that is committed to working for the people can do, and what in this instance, the people, the grassroots activists, the lobbying organizations, like the Valley Water Center, the other grassroots organizations, they never gave up. They kept pushing Sacramento until a solution was agreed upon and now implemented. And many of the beneficiaries who are now able to turn on their water tap and drink a glass of water, knowing that it is safe for them, they will never know of the work that went on to bring that clean, safe drinking water to their tap. But the important thing is that that work is being done, it is successful, and moving forward with the SAFER Act, with the Safe Affordable Fund Act for Equity and Resilience in California, we need to draw from the success of the current program to inform legislators, many new legislators now in Sacramento who weren't there in 2019, and make sure they hear from their constituents and from grassroots groups in their districts that this is a shared goal, objective, and responsibility for the people of the state of California. We can't, one, be healthy until all are healthy. And in public health work, water is the core of life. Water is nature's sustenance for all living beings, humans and animals. And so the starting point for building safe communities, healthy communities, is the water system. And if you don't have access to clean, safe drinking water, you are in the hole from the beginning. You have to go out and search of that life-sustaining water. The goal of this work is to bring it to people's homes, to their apartments, to wherever they might be living. Some people, that may be a labor camp. Some people, it may be an apartment complex. But regardless, everyone should be able to be safe and confident when they turn on that water tap. And particularly for children, some of the public health work we've done is trying to educate communities about some of the inherent health risks of some sugar sweetened beverages. The most healthful drink for children is water. Mother's breast milk followed by safe, clean drinking water. And we have part of the epidemic of child obesity is families knowing that their water isn't safe, and so they substitute it with dangerous drinking products like sugar sweetened beverages, sodas, that they can get inexpensively at corner stores, at fast food places. They cause tooth decay, they cause other health problems, child obesity, leading to preventable type 2 diabetes. So our public health is all connected, and at the core is safe, clean drinking water. So as the funding commitment from 2019 begins to wind down over the next 4 or 5 years, it is time now to make sure the state prepares, and don't wait till we run out of that funding, but to find the commitment to continue that funding until the job is done. I know Joaquin will have some thoughts to add to that as well in terms of some of the dynamics. A question at some point I would be curious to hear Joaquin address is the nexus, the connection between our current climate crisis, rising heats, heat waves, more sustained days of high heat and drought affecting water systems. How does that affect or impact the ability to also fulfill this promise of the human right to clean, safe drinking water?
Thank you, Mr. Monning, for just sharing the positive strides that can happen when government works for communities. And thank you for your thoughts there. Chairman Esquivel, I wanted to ask you the same question. Can you tell us about what the SAFER program has done and what success it's had in the past 6 years? And I know certainly there's been a lot of success in making sure that these communities are prepared for a changing climate when a solution is provided.
Really appreciate the question and really appreciate the points, Senator Monning, that you just made. I keyed in on something you had said, and that's really around a shared goal. And I think that that's a large part of the success of these last years has been the fact that it isn't just the State Water Resources Control Board and its staff here. Importantly, it's the community partners, the technical assistance providers, a growing phalanx of organizations and counties as well that are stepping up and being part of this success in the work. And that is what it has really taken, is that sense of a shared goal amongst us all, and not kind of leaving it or feeling like, well, isn't that the responsibility of X agency? The ensuring the human right to water takes all of us, and it starts at the community level where that expectation is certainly, and then where we then have partners like Community Water Center or self-help enterprises or Leadership Council for Accountability and Justice, or RCAC, the Rural Counties Assistance Corporation, all that I could, and there's additional ones, and so I don't mean to leave folks off. I think of Stantec as well. We are very fortunate for the partnerships, because the challenge truly is and has been that so much of the funding prior to the Safe and Affordable Fund and the SAFER program has been cyclical. You'd get a bond passed in the state, or some injection of dollars, and what it is really and you have to be prepared for those moments. Oftentimes, you hear the term shovel ready when infrastructure dollars are put out, and a real desire for shovel ready projects. But we know for our communities that have been without access and have needed and have real inequities and have needed this funding the most, they aren't shovel ready because they don't have the cadre and army of lawyers and engineers and all the expertise that it takes to get even a project to a fundable level of shovel ready moment. And so part of the success of the Safe and Affordable Fund and the SAFER program has importantly been creating that pipeline with technical assistance providers to start to even just have the projects ready for construction funding, which again, we've been able to fund on the construction side $1 billion worth of grants. But importantly, what the real shift has been is the creation of a pipeline of solutions and projects for communities. And again, that doesn't happen without a lot of partnership. There's no way that we could have had the impact we have now without the boots on the ground, if you will, of the organizations and communities and that are stepping up and being part of these solutions. I think even to the fact that when in 2019 to now, when the program was first established, we went through yet another turn of historic drought. And that was incredible to see the ability for us, not unlike, say, the 2012 to 2016 drought, where I think many Californians might remember, and all of us here do, that we had a real crisis in the number of dry wells that we had seen. These pressures of climate change are causing our stresses on our water resources, and particularly on groundwater, where our groundwater resources are where we go when we have surface water drought. And that the number of dry wells, the impacts on infrastructure led to this other critical moment with the passage of the Sustainable Groundwater Management Act, the first comprehensive law, the first real law that the state had put into place to manage groundwater. But it was because of those community impacts through 2012 and 2016. And so to have the Safe and Affordable Fund passed in 2019 meant that we were poised actually and able to respond to this last turn of the drought in a way that we hadn't been able to before. And it was because of a continuum of the investments from the Safe and Affordable Fund, drought dollars from the legislature, but importantly, the relationships with community organizations like Self-Help, like Community Water Center, like Leadership Council, folks that are on the ground with communities that allowed us to actually expand into the need in this last turn of the drought. So that's been part of the success as well these last years, has been the preparedness of all of us and the programs in place to actually respond to the drought in a way that was incredible to see, given that just a few short years prior, we had all struggled to be able to meet the needs and saw significant amounts of communities go dry. We saw those wells go dry again, but at least we had emergency programs in place. And again, I think that's been part of the success of the SAFER program, is that it isn't looking at any one aspect, just investing in construction or just TA or just in emergency and interim supplies. It's that whole continuum of responding to an emergency fashion, getting interim supplies so there isn't a discontinuity in people's access to water, but then also being there for the long-term solutions so as to minimize those future outages. So the successes these last years have been the number of folks that we've been able to reduce those without access to clean water for sure, but also just all the innovations and all the partnerships that have been developed that have made the difference and will allow us to continue this momentum truly, because that's what we've been able to build these last years, is an incredible amount of momentum and confidence building that we can solve this can be done. But with climate change, with contaminants of emerging concern, we know that there are future and current pressures that will continue to mean that we need to keep our eye and continue to focus on failing systems and at-risk systems. Importantly, how do we get off of this? Unfortunately, this sort of, if you will, this treadmill of smaller failing systems that are at risk that may not be failing now, but in a year or two, our one pump failure, one drought, one new emerging contaminant away from being added to that failing list. And that's another huge challenge and success of this program is trying to not just address the challenges we have today, but how do we get about in front of those challenges of tomorrow?
Thank you so much, Chairman Esquivel, for highlighting the progress, the success, the hard work put in to get communities safe and clean drinking water. And you mentioned, some of those being responding to domestic wells being impacted by drought. Know firsthand, speaking to some of those households, the stress and challenge they experience, but the Safer program has made it possible for those communities to have safe and clean drinking water in their homes because of the funding, because of this piece of legislation, and because of the program. So thank you for that and for the continuous work that the Safer program does to support water systems across the state of California. I'll be leading us into our final question, and one question for each of you. And the question is, where do you think the Safer program should go in the future? And so we'll pass it to Senator Monning for his response.
Well, thanks once again, Eric, and to all of those who have pulled together to make this information sharing possible. As stated, the work is well underway. Chairman Esquivel has assembled a team that has really performed remarkably, as he said, in collaboration and partnership with local communities and local organizations. You look at the achievement, and yet that's only offset by the ongoing or continued need of about 800,000 Californians. And the challenge is also maybe somewhat magnified as we look at the climate crisis and systems that maybe are currently working and recipients are not counted among those without access to clean, safe drinking water. They may indeed be in peril in the coming year or coming years. So part of the planning has to anticipate the deterioration of certain systems. We know that part of what I learned when I was carrying the legislation, I mentioned some of the external contaminants that can contaminate a water system of fertilizers, pesticides, etc. But some are naturally occurring like arsenic, lead, etc. But some of those toxins or contaminants only become present when the water system is stressed during times of drought, so that when you don't have a healthy water table, the stress put on it by drought allows those contaminants that would otherwise not enter the drinking water system to contaminate it. So some of this work, as the chairman mentioned, is forecasting and having the ability to kind of prioritize what are the systems in immediate need of support and help, and what are the systems that are most likely to need it over what period of time. So again, I think the work ahead on the legislative front is going to be a systematic campaign of educating all members of the Assembly, the Senate, the executive branch, and even members of our congressional delegations around the state who could be voices for future support from the federal government. We know that things are in a bit of uncertainty right now, but at the state level, we have the domestic resources, we have the domestic capacity to continue this work in the future. So the only thing that stands between a continuation of this work or the cessation of it is the political will of the legislature and the governor. And while it may seem on the surface, well, this is a no-brainer. What better investment can there be than this investment in clean, safe drinking water? But as the state budget is stressed and other priorities like education, public health, healthcare services, education, higher education are all competing for limited resources and stressed budgets, the question becomes, does this remain to be seen as a priority? I think one of the advantages we have with the current funding source coming from the Greenhouse Gas Emissions Fund is that that is a designated fund with a designated funding source that we can presume will continue. And if we can continue to protect that portion of it that has been directed to the safe, clean drinking water, to the safer funding, then we have a guaranteed ongoing funding source. We have now the capacity and the proven ability of the water agency and allies to invest that money wisely, and with the stellar result of people turning on their tap to a clean, healthy, affordable glass of drinking water. That is the goal, but we can't take awareness for granted. We have to continue the education. For advocates, they often seek to meet with an elected member. What I counsel people, it is important to meet with elected officials. It's equally important to meet with their staff, to get to know the staff, to get to know the chief of staff in Sacramento, the legislative staff person assigned to this area of work, the district director in the member's district. Get to know those people, take meetings with those folks. I can attest the staff people in Sacramento and in our districts throughout the state work very hard, and they listen. And the strongest voice is the voice of a constituent, a resident of the district that that member represents. That is the most powerful lobbying force there is. When I was in the Assembly and the Senate, I would have a organization scheduled to meet with me during the day, represented by maybe a high-paid lobbyist in Sacramento who's there every day of the week. And my staff would say, there's a group here from your district, from Salinas, from Watsonville, from Castroville. They've driven up here. They chartered a bus. They're out in the hall. I would postpone that meeting with a high-paid lobbyist to meet with my own constituents who had traveled to Sacramento to share their views, to share their needs and concerns, and to inform me what the solution would be that would work for them. So that's the power of our democracy in all of its frailties and inadequacies. You look at the success of Senate Bill 200, the success of so many hundreds, thousands of people around the state who joined hands, who stood together, and who continued to raise their voices and wouldn't take no for an answer. When we hit barriers, we figured out how to get over them, how to get around them, to bring what we have today, an effective, efficient means of grassroots investment back to the people that were advocates to assure their healthful access to safe and healthful drinking water. So I think I'll pause there. I will be the first one to support efforts to continue this funding. And I know there will be thousands of others around the state, but the organizational power of the organizations represented in this coalition, they're the ones who bring people together at the local level. They're the ones that know people by their name, by their circumstance, by the names of their children, and can see not only the challenges that these families face, but also the joy and fulfillment when a public policy victory as big as this is won at the local level. So I'll just say, carry on, adelante. Mil gracias a todos en las comunidades que trabajan en este trabajo. Vamos a ganar, vamos a continuar. Thank you.
Thank you, Senator Monning, for making the case, a strong case for why we need to continue this work. And I'll have Chairman Esquivel answer the same question: is where do you think the SAFER program should go in the future? Chairman?
Thank you, Eric, and just huge thanks to the Senator, his leadership and words. When I think of the work that is ongoing right now in the SAFER program and where things are going in the next years, to the Senator's question and point earlier, climate change continues to really stress our drinking water systems, stress our domestic well communities. And so, the need to continue to use this time right now where, the last 3 years have been fair years on the water side. We haven't, knock on wood here, found ourselves back into drought. And so this time now is really critical so that we prepare ourselves for that inevitable next turn of the drought. And so, the need for the program, but importantly, the work of the program is not finished. We know that, and especially with pressures like climate change and also emerging contaminants of concern. When I think of the work that the program is doing now on the current maximum contaminant levels we have, like, arsenic, nitrates, chrom-6, 123 TCP, that is all really critical. But what concerns me and what we know is coming down the line are additional maximum contaminant levels, because there are additional threats to public health, like PFAS, like microplastics, and other things that we may not understand yet or know about. And so what gives me concern, and what I know we continue to remain focused on, again, is not just even what systems are failing now, what maximum contaminant levels and pressures those systems face now, but into the years ahead, seeing that we know those pressures will continue, means that we need to continue to focus on this effort, focus on systems, and understand, continue to assess with data and information the challenges that they're facing, and use the time that we have now, prior to MCL's maximum contaminant levels being adopted, say, or the next drought, or the next, even flood. Flooding is of concern and damages drinking water systems. So all of those are threats that we need to continue to be mindful of and do our best now to prepare and respond as we need. And for all the drinking water systems that, say, in 2019 were out of compliance and we're making headway and bringing into compliance, we know in the intervening years here, additional systems are falling out of compliance or having challenges. And I think it's important to note that, you look at the maximum contaminant violations that are out there, and about 95% of them come from systems that serve 500 connections or fewer. So there is a direct relationship with economies of scale and size. And so it's really these smaller, disadvantaged, more rural, often isolated, but even in the urban core, smaller systems that we need to continue to focus on, and that the work continues to be critical for all the systems, again, that were out of compliance in 2019, and those that are coming back and have come out of compliance. It's important that we continue to keep our eye on the comprehensive view, ultimately, on how we support our drinking water systems in communities, and realize that the threats are mounting a bit out there. And important to note as well, though, as we focus on systems that are out of compliance, as we focus on the contaminants of emerging concern and threats out there, we don't want to scare people away from their taps as well. So that's part of the balance of the work that we need to do, is continue to build that trust and faith in drinking water systems. To Senator Monning's point, life and our health are intricately tied to our access to clean water. And when people feel that that's something that they can't trust, they either go to bottled water or other substitutes that have their own challenges unto themselves. So when I think of the program, when I think of the work, the ongoing work out there, I think of certainly the threats that continue to put pressure onto systems and need to, not unlike so many of the other great challenges in our society, it's a continual recommitment to this work and a generational investment and commitment to ensuring access to clean water and sanitation.
Thank you so much, Chairman Esquivel, for your remarks here. And I think one important thing, you mentioned a lot of great items, but you mentioned building the trust of Californians with the water at the tap. And I think programs like the SAFER program are doing that, are helping to restore that trust that Californians can have for the water. California is leading the way in terms of water quality standards and water quality for its residents. And so super important to build that trust. And so with that said, I just want to thank everyone for joining us for this National Drinking Water Week, for this important conversation. As you can see, the SAFER program is vital for the progress towards the human right to water in California. And we ask you to please tune in this Thursday as we keep the conversation going. This next time will be totalmente en español, completely in Spanish. And so tune in for Thursday's panel with the link on the screen. We hope you'll join us. And thank you so much.